Good morning and welcome to the Division of Fee-for-Service Management's 638 Tribal FQHC training. Today we are going to cover the billing requirements for 638 Tribal FQHC. Please note that these materials are designed for our fee-for-service programs, including the American Indian Health Program, also known as AIHP, Tribal Regional Behavioral Health Authorities, also known as TRBHAs, and our Tribal ALTCS programs. So when we're talking about a 638 Tribal FQHC, we are often asked the question of who can actually elect to become a 638 FQHC? Well, the answer for that is simple. Tribal 638 clinics that are assigned a provider type 05, which is a clinic, or 77, which is a behavioral health outpatient clinic, may elect to become a 638 FQHC. The only other requirement is that the clinic must be operated by a tribe or tribal organization under public law PL 93-638. So to elect to become a 638 FQHC, a tribal 638 clinic does not have to meet the requirements for receipt of grant funds under Section 330 of the Public Health Services Act, and they also do not need to meet the requirements for designation as a lookalike FQHC by the Health Resources and Services Administration. The facility also does not need to enroll in Medicare as an FQHC in order to change its designation from a 638 clinic to a 638 tribal FQHC. A facility will be recognized as an FQHC by Medicaid if it is operated by a tribe or tribal organization in accordance with Public Law 93-638. So those are the two big requirements. It just has to be a facility operated by a tribe or tribal organization under Public Law 93-638, and it has to be provider type 05 or 77. Please note that IH clinics are not eligible to become a 638 FQHC. A 638 clinic that's provider type 05 or 77 is, whereas an IHS clinic is not eligible for that. Now, when we talk about the provider type 638 FQHC, that is a new provider type designated in the Access Claims System and in the Access Provider Enrollment System, and that provider type is C5. Now, when we have a 638 FQHC, if it provides pharmacy services and or NEMT services, which are non-emergency medical transportation services, you could have a scenario where the provider chooses to keep their previous provider type in addition to the C5 provider type. So for example, a 638 FQHC that offers pharmacy services and or NEMT services could have the C5 638 FQHC provider type and its previous provider type designation, either 05 or 77, depending upon whether or not they are a clinic or a behavioral health outpatient clinic. Now, this is important to note because depending upon what service is billed, the provider may need to submit the claim using either the new C5 provider type or their previous 0577 provider type designation when they submit their claims to Access. So one thing that comes up a lot when we're discussing a 638 FQHC designation is the four walls. Now, the four walls of a 638 clinic are something that 638 clinics are intimately familiar with. It refers to the physical building that the clinic operates within. The CMS interpretation of Section 1905, subsection A8 of the Social Security Act in 42 CFR 440.90, it specifies that clinic services do not include any services delivered outside of the four walls of the clinic, unless services are provided to a homeless individual. Now, due to this interpretation, if a service takes place outside of the clinic's physical building, then that clinic is not able to be reimbursed at the facility rate for service. Instead, reimbursement gets based on the non-tribal provider and the services rendered. That is going to apply even if a tribal 638 clinic has a written care coordination agreement, also known as a CCA, in place of a non-tribal provider. So in short, if that service takes place outside of the four walls of that clinic, the clinic cannot get the facility rate. To offer an example, if you happen to be a 638 clinic and services are provided to one of your members by a neurologist that is off-site, even if you have a CCA agreement in place, your clinic would not be able to bill the all-inclusive or the AIR rate for that service. However, an FQHC has different requirements. An FQHC facility is exempt from the four walls requirement. An FQHC can bill that facility rate for services rendered to its patients outside of its four walls by a non-tribal provider. So if an FQHC does have that care coordination agreement with a non-tribal provider, like a neurologist in our previous example, and the service gets provided off-site, outside of the physical four walls of that FQHC building, the FQHC can still bill that facility rate for the service. They're exempt from the four walls. However, please note that the FQHC would have to be the one billing for the service, not the off-site provider. So still using the previous example, a member who usually goes to a 638 clinic, they happen to go and see a non-tribal provider off-site outside of the four walls of that clinic, and there's a CCA that happens to be in place. In that case, the FQHC could bill the facility rate. The off-site provider would not bill that. So what could happen is the FQHC could bill the facility rate for that service and be reimbursed, and then that FQHC could reimburse that neurologist separately. What could not happen is both providers would not be able to bill. It would have to be one or the other in that case. Please keep in mind, though, that is a separate discussion from professional fees, which will be discussed later in this presentation. Now, a tribal 638 clinic that elects to become a 638 FQHC will have that same exemption from the limitations of the four walls requirement that current FQHCs receive. Now, at a 638 FQHC, in order to bill, their rate of reimbursement will be at the facility rate, and it is going to be called the Alternative Payment Methodology, or the APM. Now, services provided in the member's home or at a facility acting as the member's home, such as an assisted living or skilled nursing facility, are also going to be eligible for reimbursement at that APM facility rate. And that is for providers who are a 05 or 77 638 clinic who elect to become a 638 FQHC clinic. Now, keep in mind, when they bill for reimbursement at that facility rate, also called the APM, that is actually going to be the equivalent of the all-inclusive rate, the OMB outpatient rate for all FQHC services. Now, up to 5 encounters visits may be billed at the AIR per member per day for distinct visits. Now, please note that our claims system is set up to automatically deny any claims that are submitted for reimbursement at the APM rate in excess of 5 per member per day. So this is going to work just like the AIR currently works, whereas an amount of 5 AIRs for a member per day can be submitted. The same goes for the APM for a 638 FQHC clinic. Our system is set up to automatically deny anything that exceeds that. Now, these encounters and visits will be differentiated based on the patient account numbers that are assigned for each encounter visit, and encounters visits do include covered telemedicine services. Now, what is not considered a tribal 638 FQHC service? Pharmacy, NEMT services, case management services for both medical and behavioral health, and group therapy are not FQHC services. Of these services, pharmacy, NEMT, and group therapy should continue to be billed as a part of their provider clinic ID provider type 0577. These 3 services cannot be billed under the 638 FQHC provider type, which, as previously discussed, is C5. Now, case management services for medical and behavioral health, when appropriate, should be billed under that new 638 FQHC provider type C5. But please keep in mind, these do not count as FQHC services. Now, when it comes to billing considerations, there are items to consider when we bill as a 638 FQHC for certain services, both for when we bill under the C5 provider type and when we bill under the previous 0577 clinic provider type. So in this presentation, we're going to cover some specifics for clinic visits and services that count as an FQHC clinic visit or service. We're going to cover pharmacy, NEMT services, case management, group therapy, dental visits, and professional services. Let's start off by discussing claim submission for qualifying 638 FQHC services. So if you have a service that qualifies as a 638 FQHC service, you would bill under the CMS 1500 claim type form, and your reimbursement rate that would be written down would be the APM, that alternative payment methodology that is the equivalent of the AIR. You would bill under provider type C5, which is a 638 FQHC. Now, keep in mind, these FQHC clinic visits have to be billed under that new provider type C5, along with the corresponding NPI number. Now, what rate gets put down on those claims? Well, the APM is put down. It's entered on the first service line of the claim, and HCPC code T1015, which is an FQHC visit encounter all-inclusive, gets used. This APM rate gets put in the total charges field, field 28. Now, in terms of HCPC codes and charges, claims have to include any HCPC code, including E&M codes describing the services rendered as a part of the visit. These individual services get billed with a $0 charge in the charges column, column F of the CMS 1500 claim form. Because remember, that APM rate is put on the first line of the claim form. Any additional HCPC codes are listed after. In terms of modifiers, when multiple visits on the same day that are distinct and separate visits get identified, you have to bill the T1015 HCPC code with modifier 25. That modifier gets entered under the modifier column in section D, procedures, services, or supplies on the CMS 1500 claim form. Now let's talk about pharmacy. Previously, we mentioned that pharmacy is not an FQHC service and that it would have to be billed under the previous provider type of 05. So how does this get billed? Well, the claim form, the UB04, would get used. The reimbursement rate listed would be the all-inclusive rate, and the provider type listed would be 05. Now keep in mind, on the UB04 claim form, you must include all NDC codes for all prescriptions filled that day, and only one AIR will be reimbursed. The outpatient AIR should be entered on the first service line of the claim, and revenue code 0519, other clinic, should be used. Include the AIR in the total charges field, which is field 47 of the UB04 form, on the 0001 line. Claims should be submitted with that facility's NPI as the attending provider, since Access does not register pharmacists. Now keep in mind, the facility's NPI as the attending provider is under their previous provider type of 05 or clinic. Pharmacy service cannot be billed under the new 638 FQHC provider type. Again, they must be billed under the provider's previous designation 05. The reimbursement methodology for pharmacy services is not going to change and shall continue to be reimbursed at the all-inclusive rate. And again, as a reminder, only one AIR per member per day per pharmacy can be reimbursed. The AIR limits for pharmacies will not change for providers who elect a 638 FQHC status. Now let's talk about non-emergency medical transportation, or NEMT services. Those would be billed, again, under the CMS 1500 claim form, and their reimbursement rate would be a capped fee-for-service fee schedule. Because this is not considered an FQHC service, it would be billed under the previous provider type 0577, so either under their clinic or behavioral health outpatient clinic. They cannot be billed under the new 638 FQHC provider type, which is C5. They have to be billed under that previous designation 05 or 77. And the reimbursement methodology for NEMT services is not going to change either. It will continue to be reimbursed at the capped fee-for-service fee schedule. It will not be reimbursed at the APM rate. So just to recap, when we talk about pharmacy services and NEMT services, they will continue to be billed under their previous designation. In the case of pharmacy, under 05, and in the case of NEMT, under either 05 or 77. And their reimbursement methodology will not change. For pharmacy, it will continue to be the AIR, and for NEMT, it will continue to be the capped fee-for-service rate. Now let's talk about group therapy. Group therapy will be billed on a CMS 1500 claim form. It will be reimbursed at the capped fee-for-service fee schedule, and that too will be billed under the previous provider type of 05 or 77. Group therapy and any other service that gets provided to a group is not going to qualify as an FQHC service because it's not a face-to-face encounter. An FQHC service has to be a face-to-face encounter for it to qualify as a facility service. Now, that visit must be one-on-one to qualify as a facility service, and that is why group therapy is disqualified from that, along with any other service provided to a group. So those cannot be a PPS eligible service. That is why group therapy is billed at the fee-for-service rate, as we saw in the previous slide. Let's talk about case management. And this goes for both medical and behavioral health services. So case management is another thing that is not an FQHC service. And that would be billed on the CMS 1500 claim form, and it would be billed under the capped fee-for-service fee schedule. But please note, when billing case management services, this would be billed under the provider type C5. So even though this is not a 638 FQHC facility service that would be reimbursed at the APM, you would bill still under C5. You would not bill under the previous designation. So please note that would be a CMS 1500 claim form, reimbursed at the capped fee-for-service fee schedule, and the provider type C5 or 638 FQHC is what is used when you are billing for case management services for both medical and behavioral health. Now, please note, if your 638 facility happens to be an American Indian medical home, or also known as an AMI, they will not be eligible for reimbursement of the T1016 code. An AMI already receives the per member per monthly rate, which is why they are not eligible to have reimbursement of the T1016 case management code. Let's talk about dental. So dental services are going to continue to be billed under the ADA 2012 claim form, and their reimbursement rate will be that alternative payment methodology, or the APM, under provider type C5. FQHC dental visits must be billed under the new provider type C5, and just keep in mind, they have to be billed under the corresponding NPI number. Professional services. Again, those would be billed on the CMS 1500 claim form. Their reimbursement rate would be the capped fee-for-service fee schedule. And the provider type, well, that is going to not change. That's going to continue to be the individual practitioner's provider type. So if I happen to be a cardiologist working out of the 638 FQHC, I would use that provider type. There's some other items to note when it comes to a 638 FQHC. First and foremost, telehealth and telemedicine visits may qualify as an actual facility visit if they meet the requirements specified in the AMPM, which is our Access Medical Policy Manual 320I, which covers telehealth and telemedicine requirements. Behavioral health technician services, excluding case management, can qualify as an FQHC or RHC facility visit when those services qualify as services incident to the services of an FQHC RHC practitioner consistent with 42 CFR 405.2462. For information, please see the Code of Federal Regulations. So we have been asked, how would you elect to become a 638 FQHC? Well, any tribal 638 clinic electing to become a tribal 638 FQHC, first and foremost, they must meet those requirements. They must be a tribal 638 FQHC operating under public law. They must be a provider type 05 clinic or 77 behavioral health outpatient clinic. Then they must submit written notification to the Access Administration's provider registration section. Please note, our provider registration unit's name is changing to provider enrollment. The written notification must include the name of the tribal 638 clinic electing to change its designation, the full address of the tribal 638 clinic, the date that the tribal 638 clinic is requesting the designation change to go into effect, and a signature from one of the authorized signers on record for the provider within the provider's current provider profile. On this page, we have the address and fax information where that could be sent. Keep in mind, there's no cost to elect to change from a tribal 638 clinic to a tribal 638 FQHC. And if a provider has not been previously registered with Access, as always, the provider must follow all existing new provider registration steps. If you have any questions, please outreach the DFSM provider training team at provider training fee-for-service@azaccess.gov. Keep in mind the fee-for-service in the email address is abbreviated to FFS. So it is provider training, FFS, @azaccess.gov. ahcccs.gov. Thank you for taking the time to listen to our training presentation on 638 FQHCs, and we hope that everybody has enjoyed their experience. And if you do have questions, please do not hesitate to outreach.